In fact, more women die of heart disease every year than men do. And by the time that we reach menopause, it's an equal opportunity disease for men and women.
I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. February is the month of Valentines and hearts, the real kind, that is. It's Heart Health Month in the U.S., and we're kicking it off at Geneve with a podcast featuring cardiologist and internist Dr. Sarah Speck. As her website says, Dr. Speck believes preventing illness is the best approach to managing health and maintaining vitality. She gave us a whole lot of great information on what heart disease is, what to look for, and how you can start today to reduce your risk and maximize your health. February is Heart Health Month, and heart disease is the number one killer of women.
Yes,
I understand. Can you tell us a little bit more about that statistic? Because I think that's really shocking.
Well, it's an unfortunate statistic, but in fact, more women die of heart disease every year than men do. And by the time that we reach menopause, it's an equal opportunity disease for men and women. But unfortunately, even at the age of 45, 1 in 9 women will have some form of heart disease, as opposed to 1 in 5 men. By the age of 65, 1 in 3 women will have heart disease, as opposed to 1 in 2 men. So we have a real opportunity, if we can turn that around, in early menopause to impact our risk of developing heart disease later in life.
Why is that statistic? I guess. Why are women more prone to this than men? And it sounds like women catch up to be an equal opportunity player. Sadly, I'd rather we were equal opportunity in lots of other ways. But why do women catch up? And then why is it killing women as a number one killer?
Well, I think, take your first question, the fact that we lose our natural estrogens, we lose elasticity in our skin, our hair changes, our eyes change, and our blood vessels change. And our blood vessels, the further away we get from our natural menopause, the more difficult, more brittle, if you will, our blood vessels become, and more vulnerable to developing cholesterol-related plaque. So that's really why we catch up, is that even taking synthetic estrogens don't really restore the health of our blood vessels that we had pre-menopause.
That's fascinating. Okay, so taking synthetic estrogen, how about like the bioidentical, or is there any form of estrogen in HRT or any hormone-related therapy that can reverse that damage to our blood vessels?
We've not been able to identify a hormone replacement therapy, either bioidentical or whether it's patch or whether it's oral therapy, that actually reverses or restores the flexibility. So what we really want to do is concentrate on those risk factors that we know can create more inflammation than just losing our natural estrogens. And those are high blood pressure, diabetes, having high cholesterol, being obese, being exposed to tobacco products. Those are the big 5, if you will, for men and for women. But women become much more vulnerable to those after their menopause. As to your second question, I think the reason that women may die more of heart disease is because we don't recognize that we're necessarily at risk. So if you have any of those big risk factors, you may have atherosclerosis, even if you're just having nausea, even if you're just having unusual shortness of breath, even if you're just unusually tired. It may be that your arteries are clogged and your heart isn't able to function as well as it used to. And so those individuals who have those risk factors need to seek attention from their providers.
So, I was about to say the word fascinating because I think it is like when I think about heart disease versus a heart attack, I know what a heart attack is, but heart disease as a disease, what is that? How do you know when you've now got it? And then obviously it's something that you manage, but is it like other diseases where there's symptoms, you do things to control it, but it never really goes away?
Good question. several aspects of the heart, obviously. There's the muscle, there's the valves, there are the electrical fibers, and there are the blood vessels that supply the heart. So any of those can become diseased, and there are congenital reasons for people to have heart disease that they're born with. But what we want to talk about today, I think, are the disease of the blood vessel that's more or less acquired. And those individuals who have disease of the blood vessel, again, that can be very insidious. It can happen over decades before it actually declares symptoms. So that's why we want to pay so much attention to those risk factors. Because really what causes heart disease that causes heart attacks, or those that cause strokes also, is that there's inflammation on the inside lining of the blood vessel. And when there's inflammation on the inside lining of the blood vessel, it looks very much like the skin of somebody who's having a bad outbreak of psoriasis or eczema. It's cracked, it's weepy, it's red, it's angry. And as the blood goes flowing by, the particles of bad cholesterol, the lousy cholesterol, the LDL cholesterol, literally drop through the cracks and start to form plaque in that little layer between the lining of the blood vessel and the muscle layer. And that can happen decades before anyone develops any symptoms.
The symptoms that you mentioned earlier, feeling tired, shortness of breath, they're kind of everyday symptoms. What are the top symptoms that you encourage women to look for? And at what point should they take those symptoms seriously enough to come in and get checked?
While women may have symptoms that are unique to them and somewhat different than men, the reason that women have symptoms of heart disease is the same, and that is that the heart muscle is not getting enough oxygen to be able to pump the blood forward effectively to the rest of the body. And so like any pump, when it doesn't pump well, it creates a back pressure. And oftentimes the first place it creates that back pressure is in the lungs, so you start to feel short of breath. So if on your routine walk you're feeling like, wow, I don't know why I can't get through this today, and you have high blood pressure, or you have diabetes, or you're overweight, or you have high cholesterol, or you have a family history of heart disease, that's something to pay attention to. Certainly, if you walk up James Street from the ferry dock and you're gasping for breath and there's an elephant sitting on your chest, whether you're a man or a woman, you need to seek medical attention, more or less immediately.
Yeah. It seems pretty straightforward, but do you see in the majority of your patients people waiting far too long, or what are trends that you see in terms of that level of awareness of people coming to you to say, I think I need to get checked, or do they wait far too long? Where do people kind of line up?
In the immediate throes of having a heart attack, women traditionally wait an hour longer than men do to call 911. Because they think, oh, it's just indigestion, or I don't want to upset anybody. I don't really want to wake up my husband. I don't really want to call my daughter, particularly if women are living alone. And so they may not be getting the life-saving treatments that are offered fast enough to delay the consequences of having a serious heart attack. So, but in the more preventive sense, I think, again, women need to be aware that heart disease is the biggest killer. And just like we get our annual mammograms, we need to know our numbers annually. What's your blood pressure? We all know what our weight is. What's your waist measurement? If your waist measurement is greater than 35 inches, you're at significantly increased risk for heart disease and diabetes, and you need to take care of that. If your blood pressure is greater than 130 over 80, now according to the American Heart Association standards, that needs to be addressed. Doesn't necessarily need medication, but it needs to be addressed and it needs to be followed. If your blood sugar is greater than 100, certainly if it's greater than 110 or 125, you need to be addressing diabetes or prediabetes. If you're smoking or if you're exposed to tobacco, stop.
Very simple.
But the other thing that's unique to women that I think is now coming forward is if you've had gestational diabetes, high blood sugar during pregnancy, if you've had high blood pressure during pregnancy, even if you don't have a family history of heart disease, at age 50, you're more likely to develop high blood pressure or diabetes than somebody who hasn't had that during their pregnancy. So you're the one who's carrying that information. You're the one that needs to be taking care of that for yourself. The other thing I think is really important is that we all start to think about building our own health portfolio just as carefully as we do building our own financial portfolio. We find a provider that we can work with. We find somebody that we can trust to put investment in that health portfolio. We take care of what we need to, and we go forward building it together.
Yeah, I think that's a fascinating way to think about it, because even you just listed out a number of numbers that you should know and be aware of, which, as you called those out, I know I certainly am not aware of mine.
Right.
And it shows how important it is for a person, a woman or a man, to be just tracking their own numbers.
That's very correct. Because the sooner you jump on it, the more opportunity you have to not develop serious disease in the future. The other thing is that we now have a variety of techniques that can develop early atherosclerosis or early plaque development. One is called Carotid Imt Scan, and basically it's just an ultrasound of your carotid artery that looks for early development of plaque. That's paid for by your insurance after you've had a stroke, but that means you had a plaque buildup that's 80, 85, 90%. Mm-hmm. I'm talking about detecting something that's 10 or 15%. Well, at 10 or 15%, you're not going to have any symptoms, but if you've got it, you can stop it by paying attention to the risk factors that may continue to contribute to it over time. While it's not covered by insurance, it's usually an out-of-pocket expense of somewhere between $100 and $200. And those kinds of things are readily available in the medical community, so that even if your insurance company doesn't pay for it, doesn't mean it's not worthwhile.
You know, now here at Speck Health, you are big on prevention, and you're starting to go there in our conversation. Tell me about POTENTRx. It's a program that you have here, and how you're really advocating for prevention with your patients.
So we pronounce it POTENTRx, your prescription for your full potential. And it grew out of my experience as the medical director for cardiac rehabilitation services at Swedish Medical Center for the last 2 decades. And again, after you've had a heart attack, after you've had bypass surgery, your insurance company will pay for you to learn about proper nutrition and how to exercise to prevent your second event. That seemed a little backwards to me.
That you have to have an event first before.
Exactly. Yeah. So there are all kinds of guidelines from the American Heart Association, the American College of Cardiology, the American Medical Association, telling people that exercise and nutrition will prevent disease. But again, unfortunately, our medical system doesn't pay for that under the insurance system. So I partnered with Dr. Dan Trips, who's a PhD exercise physiologist and psychologist, and he and I looked at what people were getting in cardiac rehab and said, you know, I think we could do this beforehand to help people who are concerned about disease or have early risk factors or have early disease, prevent them from developing more severe and more debilitating illness. And so what we do basically is take the same science that does assessments for elite athletes, where these people know exactly what their body's burning, exactly what their body is using, exactly what nutrition, so they can get their extra 100th second across the finish line first, and we bring it to the world of mere mortals because we're all on the same physical performance curve. And what we do is precisely measure what an individual's body, how they use carbohydrates, how they use fats, how their muscles work, and we design a nutrition and an exercise prescription for them that will help them lower their blood sugar, lower their body weight, improve their heart's performance, lower their cholesterol, whatever their goal is, and then we coach them through that.
Fantastic. So you're kind of like a quote-unquote personal trainer, but much more in depth.
We like to talk of ourselves as a medical fitness company. Yeah. Again, I think personal trainers are very valuable, but I think they don't have that medical knowledge as to how this person's body truly performs to reach their medical goals as opposed to getting down the slopes a little faster.
Yeah. And so then the medical goals and approaching your medical goals, how do you price this just to go there? Because I'm assuming it's not covered under insurance, but if I were to think about the mental model, a lot of us spend a lot of money on classes or a personal trainer or a health club membership. The services range the assessment services range anywhere from $200 to $700. And then depending on what kind of ongoing coaching you would like, that can be done over the web, that can be done through email or through fitness apps. Again, it depends on what the client is trying to achieve. I love the whole notion that you've taken the recipe that what elite athletes use and brought it down to, I shouldn't say down, brought it over to those that are aging and that want to manage their personal health in this area.
And we're all on a continuum of performance. You know, we're fit, we're athletic, but that fit and athletic can become injured, and that's where we are injured and impaired when we're trying to deal with health issues, and we're just trying to move you toward more healthy and more fit.
For our local listeners and those willing to travel to Seattle, we have amazing news. Dr. Speck has offered a free heart health assessment worth over $600 US for one of our listeners. Stay tuned to Geneve.com or sign up for our weekly newsletter at Geneve.com for more details coming soon. So going back to the topic of women versus men, are the indicators or symptoms that you're having a heart attack the same across both, or do women need to watch for different things? And maybe I shouldn't say just isolated to heart attack, but heart disease. Are the symptoms the same across both sexes?
Again, if you're having chest pain while you're walking up a hill, whether you're a man or a woman, that should indicate you that this could potentially be heart disease. If you are knowing that you have high blood pressure, if you are knowing that you have high blood sugar, if you know that you have high cholesterol, or you have a family history of heart disease, and you develop chest pain because your daughter came home and told you that she's getting divorced, that's a symptom that women have more often than men do.
It's emotionally
and that's a real
induced.
system. Exactly.
Wow.
Exactly. Because those produce those kinds of emotions produce very real biochemical change that can alter the way your heart's blood vessels react to that change and can produce a symptom of chest pain. Undue shortness of breath. And again, what I mean by undue is if suddenly you're pushing the cart around the grocery store and you're, then that's unusual, and that needs to be investigated. Heart disease is something that is progressive. So if you have a symptom 1 week and the next week you have it 3 times, again, that's something to listen to and not dismiss. That, oh, that was just indigestion, or oh, that was just, I was kind of tired that day, or my asthma was acting up.
Mm-hmm. What would you recommend to women who are now on the other side of menopause, or even kind of going through it, but obviously the impacts of lower estrogen in the body have taken their effect? What would you recommend for just lifestyle and prevention? And it's probably quite apparent in terms of no smoking, diet, exercise, etc. But I think it's good to just continue to remind and reiterate.
Sure. Again, if we think of this as a disease of inflammation, and this is, you think that your blood vessels are on fire on inside, and what you want to do is calm the fire. So what we know does that is regular exercise. If you move the muscles between your waist and your knees, which are big muscles, as all women know, but for 30 minutes every day, that reduces inflammation in your blood vessels. It may not cause you to lose weight. It may not make you more fit, but it reduces the inflammation inside your blood vessels. And it doesn't have to even be all at once. 10 minutes 3 times a day is just as good as 30 minutes all at once. So that's where those Fitbit counters come in helpful, these step counters to get people to move more. That's number one. Number 2 is eating a double cheeseburger is like putting a Brillo pad inside your blood vessels. So what you want to do is eat more sensibly, eat more responsibly, eat more plant-based foods. The American Heart Association recommends 5/5. 5 servings of fruit every day, 5 servings of vegetables. A serving is a half a cup. So if you have an apple, you've had 2 servings of fruit. If you have a salad, throw in some craisins, throw in some nuts. It's not too hard to get there if you pay attention. Those things are pretty easy and accessible to most of us. I think the other thing is to try and embrace joy every day. To find a way to manage your stress so that your stress doesn't manage you. And if you can just do those 3 things, you'll create an environment where you can start to look at your own health portfolio more seriously and more proactively.
That's fantastic. Are there any innovations in this space that are coming that you're really excited about?
There are several, actually. First of all, I'm really excited about the fact that people in the medical community now realize that heart disease can be prevented. And so even though our insurance system is lacking in terms of actually paying for prevention, your provider is going to ask you what your blood pressure is. Your provider is going to be checking for these things and embracing your efforts to improve them over time and early. I think that level of awareness is just going to continue to grow. I think that cardiac genomics, The whole genomic revolution is going to not only revolutionize cancer, but also the treatment for heart disease. We now commercially identified 4 or 5 genes that you can just get a simple blood test to see whether or not you're carriers of those. It doesn't mean you're going to get heart disease, but it means that you've had them since you were born. And so they've been interacting with whatever else you've been doing to try and cause heart disease. And so once you identify whether or not you're a carrier of those, you can be even more proactive in reducing the things that you know you can control. Because really, even with people who have a family history of heart disease, 80% of getting heart disease is still under our control. That's phenomenal.
Mm-hmm. Yeah. You know, and in a world where we don't get to control a whole lot, that's pretty fantastic, right. You know. Well, this has been a pleasure. Oh my gosh. You know, we hear so much about heart disease, and yet we never really understand what it is and that it is so preventable. So thank you.
Thank you very much for having me, and good luck to you and to your health portfolio.
Thank you so much. Thanks so much to Dr. Sarah Speck for a fascinating conversation on the mechanisms of heart disease and how to protect yourself against it. You can find out more about Dr. Speck and POTENTRx, her heart health program, by making an appointment at her website at drspeck.com. That's DrSpeck.com. Next up, we talk with author and motivational speaker Juju Hook. We reviewed her book, Hot Flashes, Carpools, and Dirty Martinis, at Geneve.com, and she kindly agreed to talk with us on why midlife needs a rebrand and how women can power up and step into prime time. You do not want to miss this. I'll see you soon. Thanks for listening to the Geneve podcast series. We welcome your feedback at Geneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Geneve podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Geneve website for new stories and offers all dedicated to women's midlife health.